and we'd like to welcome you to our webinar today for Advancing EVP. We have Pam Werb with us here today. She's a certified life skills trainer. Thanks for being with us, Pam. We're so glad that you're here. And I'll just quickly introduce her. Pam Werb is a member of NHPA's National Network of Certified Life Skills Trainers. Pam has been working for NHPA since 2001, conducting LST trainings throughout the U.S. and training other teachers in the LST program. She has 7 years' experience working with elementary and middle school teachers and students in the Life Skills Training program. And when not working for NHPA, Pam writes tobacco cessation and training programs for publishers and employee assistance plans. She serves as a technical consultant to the Minnesota Department of Children, Families and Learning, and conducts research trials and lectures at the University of Minnesota Medical School. Pam has a Master's of Education degree in Curriculum and Instruction from the University of Minnesota and a Bachelor of Science degree in Elementary Education from the University of Minnesota. Pam taught for 5 years and has conducted tobacco research, run clinical trials and worksite interventions and published programs for the last 17 years. Hi, Pam. Thanks for being here.
Hi, Jen. Thanks so much. It's a delight. Thanks for inviting me.
Now, as far as our attendees go, if you have any technical difficulties, please send me a message via the chat box. I know GoToWebinar sent out a little warning a few days ago that there had been some audio issues, but those are supposed to be resolved, and we've had some good luck in the last few minutes here. So let us know, though, if there are issues. Pam, we will go ahead and turn things over to you.
Thank you, Jen. So we're gathered in our webinar today to talk really about promoting positive youth development, health, and well-being through life skills training. In general, we'll cover these points during our hour together. We're going to start off with a brief review looking at what the research tells us. We'll talk a little bit about what is evidence-based prevention and why is it important to use an evidence-based tool. We'll have a refined look at what life skills training really is, taking a look at the curriculum span from age 8 to 18. We'll talk about some potential outcomes that can occur with life skills training. We'll talk a little bit about some tools that are available to support the curriculum manual and the student guides. There's some online resources that are also available, and we'll have time for some questions and answers. So as we get going, thank you again, Jen, for hosting this session. When we think about the issues that face us as a population, I would like to talk a little bit about modifiable death and disease. And so as we take a look at this slide, you can see that certainly there is a whole host of behaviors that we see spanning the screen in front of you that are really modifiable risks that we are engaged in. This really is the toolkit of unhealthy behaviors. And this is exactly mirrored in what we see assessment-wise from the Centers for Disease Control in terms of the Youth Risk Behavior Surveillance Survey. When we think about the behaviors that we are documenting, and you will see this also echoed sometimes in state tools that are used. If you're not using the Youth Risk Behavior Surveillance Survey, you may have California Healthy Kids data. Here in Minnesota, I might have the Minnesota Student Survey. And when we take a look at the span of unhealthy risk-taking that our population is engaged in, tobacco use, alcohol, unintended injury, motor vehicular accidents, early sexual debut, self-inflicted unhealthy risk-taking, lack of physical activity. And so these are really it's a quick snapshot of what we are up to in our population. And then we come along with school-based prevention. And so just to kind of level the playing field, when we think about a prevention program, and life skills training is a prevention program, the spotlight is really on the child. And so here we see Dale, a colleague, doing a life skills training class in an elementary setting, And the spotlight is on each one of those children. It's really not so much focused on the whole environment surrounding them or the community or their family or their peer group. It's about the child making choices that are healthy and best for them. And using the Institute of Medicine classification for the continuum of care, you can see that this is a universal prevention program. I'm sorry, let me just go back there for a minute. This is a universal prevention program, and in a universal prevention program on that whole spectrum, that means it really is targeting everyone. It's not just focusing on someone who maybe would be self-selecting or identified as high risk, or someone who maybe is somewhere on that spectrum of unhealthy risk-taking to an intervention type setting. And so we really are focused on prevention programs and skills for everyone. We certainly know from research and from study in the field that not everything works. If I go back to my elementary experience, I certainly remember that there were some scare tactics that came in. That maybe we were just going to practice saying maybe one technique. Maybe I was just going to say no, or I was just going to avoid a situation. We certainly know that standalone programs, just a one-shot experience of something is not going to be comprehensively effective. And programs that really focus just on drug information, maybe what's going on from that unhealthy risk-taking, the modifiable risk spectrum that we just saw a few minutes ago, those kinds of programs focus just on a particular substance or focus just on unhealthy risk-taking actually have kind of a boomerang back to us in terms of actually increasing the behaviors that we might indeed want to extinguish. When we talk about an evidence-based approach then, that's what we're after here today. Life skills training is one of a short list of programs that really has been replicated and researched for many, many years. You're going to see a body of research in our middle school program that spans more than 30 years. In an evidence-based program, that is important because the stakes are high for us to get this right. Thinking back to the risk behaviors that are being monitored on the Youth Risk Surveillance Survey study or on California Healthy Kids, you'll see that those stakes are very high for us to get this right because it's healthy youth development for kids that we really are after, helping to build a path for them to experience their best potential and future. It is about healthy youth development. Each one of us on this call today has come with a set of experiences and learnings and understandings. It really is the totality of who we are in our profession and in our sphere of influence today. We have a toolkit, so to speak, that we've come armed with. The children that we encounter in diverse settings, whether you're in a classroom or in an after-school program or in a faith community or in a boys or girls club, the children that we come in contact with on a daily basis also bring with their own toolkits. And that's what we're after in life skills training, as we're going to take a look in just a couple of minutes, the scope and sequence of the kinds of topics that are included at the elementary, middle, and high school level. These are the skills that we really want to foster for healthy youth development. And while you may see that we certainly have a profound impact in terms of delaying experimentation or reducing unhealthy risk-taking behaviors across multiple substances, it's that protective skill set that we really want to build. You're going to see that we have lessons on marijuana, alcohol, and tobacco, but not on the entire spectrum of unhealthy risk-taking. Going back again to building that protective bubble, so to speak, around kids in terms of having them understand that we have self-image, we have self-esteem, that there are many factors that impact it, that we make a lot of decisions, that we communicate, that we can stand up for ourselves assertively. We're going to look at and see that not only are skills important, but knowledge and information come into the totality of really making those protective changes happen in kids' lives. It is an evidence-based approach that is tested and proven effective. We have a program that has been through peer-reviewed clinical trials and has been replicated. When we look at the short-term effects, and I'm also going to just show you a few slides here that will show some of the research. I'm going to mention as well that on LifeSkills-Training.com there is a research tab on our homepage, and if you would just click on that, you'd be able to pull up 20 or 30 peer-reviewed studies that would show some of this research and additional populations and specific endpoints as well. But as we take a look at this very first slide here, I'd like to call attention. You're going to see that this is the control group that has had not only the foundational one-year program, but has had the reinforcement of subsequent implementation in years 2 and year 3. And so we see in terms of the vertical axis with the percent of kids engaged in unhealthy risk-taking on a weekly basis, we see that life skills alone has a protective factor, but with the booster session, we have even an increased impact, both across tobacco and marijuana on these studies. In terms of the long-term studies, looking out at life skills training, we see protective factors going across multiple substances. So not just alcohol, not just tobacco, but across multiple substances. And that's important for me when I think of the scope and sequence of the content that is included in our program. You're going to see that while we have kids in our elementary, middle, and high school settings that are in a healthy place, not everyone, not all of our student population, not all of our community population is engaged in necessarily healthy behaviors. And so I want you to also, as you look at the scope and sequence of our material today, think about how will this resonate with kids who maybe are on the spectrum with some unhealthy risk-taking. Indeed, maybe those are kids who do need to know some anger or anxiety management techniques. Maybe those are kids who could benefit from a decision-making matrix that could help them parcel out the information that goes into coming to some kind of conclusion or a decision. So again, both short-term and long-term studies exist to support the impact of life skills training. This study also shows, again, the reduction in risk-taking that is unhealthy for kids who are engaged in life skills training. So we see that most profound reduction happening across the board in multiple substances. Not only in terms of substance abuse, but we also have an impact that has been proven in violence and delinquency. And that's important. It's hard to reach our kids if they're truant. If the kids are not in our after-school program, if the kids are not in our classrooms, it's hard to have an impact on them. We have studies here that have shown a decrease in physical aggression and verbal aggression in both spanning delinquency and in fighting. In our elementary studies, we've even seen an increase in self-image and self-esteem. And then finally, I'll just flip back to this slide. In terms of the long-term context, we now have a study that came out last spring in the Blueprints Convention in San Antonio. More details of this could be found on our website as well under that research tab. But it shows the protective factors now lingering 12 years later, following that middle school cohort from level 1, 2, and 3 from 7th, 8th, or 9th grade into their mid-20s, and we can still see that there is a significant protective factor that follows this cohort now, and so that's very exciting when we can see that not only do we have short-term immediate impact on behaviors that kids are engaged, but if we can delay and ultimately even prevent some of this, that's very powerful. I've spent the bulk of my career as a tobacco researcher, and we know that 90% of the kids who go on to become lifetime smokers start before the age of 19. This is profoundly important because knowing that, if we can delay that experimentation or unhealthy risk-taking, it is very powerful. We see those same kinds of protective factors surrounding kids in non-prescription use of or misuse of medication, and also specifically in the use of narcotics or tranquilizers. You've heard me say that this is an evidence-based program. There are evidence-based programs, but it's important to really pick the program that will fit your setting. Again, looking very critically at the kinds of materials that you need to assemble, to look at the research that supports the outcomes that might be important to you in your implementation in your community. Life skills training has been recognized by the National Registry of Effective Prevention Programs and a whole host of other agencies that look to help us pick a program that will make a difference. Again, we don't have more time or money to spend implementing a program. We want to make sure that if we're going to do that, we want to have a program that works. The Centers for Disease Control tell us that in order to make a difference in the lives of kids, they need to be ready, willing, and able to learn. That is the crux of the coordinated school health model, and I know that that model is being replicated and has been replicated in many states for a long time. It's wonderful to have Common Core standards. It's great to assess kids in competencies in particular curriculum areas, but if kids ultimately are not ready, willing, and able in your classrooms or your settings, if they're not present, you really can't do anything more than that. And so this is a wonderful, wonderful opportunity to build those connections and augment the work that you may be doing within your setting. When we look at the way that life skills training has been implemented, this has become more diverse and much more robust in my 14 years of experience. I did start out in a classroom. I started out in the state of Minnesota showcasing evidence-based programs around the state to K-12 settings. And so I was pretty community-based and very, very much based in the 336 school districts in my state. But it didn't take long before the public health agencies were at the table too. And so we see this program being used not only by schools and school districts, by health educators, but also by prevention specialists, certainly those public health agencies partnering wherever kids can be found. It could be in a school, it could be in an after-school program, it could be in those coalitions that are springing up and exist very robustly around the country as well. The program has been taught by peer leaders. I had an opportunity to work with an AP developmental psychology program in one of our high schools where they were going in to do life skills training with an elementary classroom. It's been done by teachers and guidance counselors. It's been done in after-school programs and faith-based community day camps. I've even trained Boy Scout and Girl Scout leaders. And so the creativity of the implementation is there. We'll talk a little bit more about what it means to do the program in just a moment. This is a snapshot of life skills training, and as we take a look at the program, you'll see that it does span from age 8 to 18. And as we take a look at the program, here we see the elementary program, level 1, 2, and 3, and then you'll see the targeted grade levels right underneath each level. That's important because if you're implementing this in a classroom, there is no school configuration in America anymore. They have campuses that exist for a student census or population, so you might have a 4-5 building. You might have a K-5 setting. You might have a middle school, or maybe you're doing a junior high school format in your community. So this level system really lets you adapt the program to best fit the physical configuration of the way you have gathered the students in your community. In the elementary level here, you're seeing the manual. This is level 1, level 2, and level 3. And these are the student guides, again, right underneath the teacher manual. I like life skills training because I want to make a difference. I don't have time to mess around at this stage in my career. I want to make sure that what I'm doing makes a difference, and I can trust the evidence that has supported the program for more than 30 years. I also like this program because it's very interactive. This is not a program. Life skills training is not a program that you do to kids. It really is a program that you do with kids in partnership with them. And so you'll see that there are interactive teaching strategies built right into each level of the manuals at elementary, middle, and at our high school level that really keep this very engaging. We facilitate some kind of conversation. We coach some kind of behavioral skill acquisition. We model the use of the information that we really are presenting, and it's all about that toolkit. In the behavior rehearsal, that's sort of the verb in life skills training. It's the action. It's where kids take on that content and then practice that kind of activity in a real life situation in their own lives. At the elementary level, a life skills training class takes about 30 minutes, 30 to 35 minutes, and there are 8 sessions at each level. You're going to see at the elementary program that the content is the same, the content topics are the same, but the level of sophistication that the kids experience with that content is different, as you can well imagine them progressing from 3rd to 4th or 5th and 6th grade. At the middle school level, we have 3 levels. There's a level 1, level 2, or 3, depending on whether you're configured as a middle or a junior high school setting. A typical lesson here is a little bit longer. We take a deeper dive into topics, and so a lesson will take about 40 to 45 minutes. Most topics take just 1 class period. There are 3 lessons in the middle school level 1 that take 2 class periods. There's a lot of material that's a little more dense, and so you'll be able to see that clearly identified by the time cues right in the teacher manual. Across the board, each lesson starts with a goal and has clearly identified learning objectives. At the elementary program, at the end of every lesson, there's a take-home letter to connect us to that parent, family, guardian in the child's life. And so each lesson has some kind of take-home. At the middle school and the high school level, there are companion online resources that we'll talk about in a minute. Again, to summarize the middle school lesson, 15 lessons here, 10 in middle school level 2, and 5 lessons in middle school 3, and then a typical lesson being 45 minutes long. And that goes right over into our high school lessons as well. There are 7 units and 10 class periods at the high school program, and the transition program is really targeting kids as they are coming to the end of their high school years, getting ready to transition to something next. It could be the workplace, it could be a military or volunteer service, it could be post-secondary education of some sort. And we know from research that at those moments of transition, certainly from elementary to middle, middle to high school, and then on into the world, we are most vulnerable. And so it's the time for us to equip ourselves to navigate those new situations in a healthy, effective way for us. Here you'll see the information spelled out a little bit more clearly. The elementary program with a student guide and a teacher manual. Not a lot of other stuff to have to gather. It's a very simple, straightforward program. The layout of the manual is really just like a cookbook. It gives you the recipe and you follow the instructions. In the middle school level here, you're going to see that there is a teacher manual and a student guide for every level. There are a couple of other media pieces that are included. There is a smoking biofeedback DVD that shows the short-term consequences to tobacco use in terms of psychomotor skill steadiness and in terms of accelerated heart rate. And there is a stress management CD that also supports the program with some of those exercises to practice. In terms of electronic support, there is a free companion website that supports the middle school, high school, and transition program levels. The website has activities for the students for every single unit. So there are activities that support each unit within the curriculum. An example of the format would be a gaming type activity. So if I were doing the self-image or self-esteem unit, there could be a crossword puzzle or a concentration game type activity. There would also be an interactive quiz, 10 questions checking my understanding of information throughout that particular unit and topic. And if I was not able to successfully navigate that quiz, it would prompt me to the right answer. When we go to the high school level, a gaming type activity and a self-assessment quiz that's interactive are included, but there also is a small article tied to the content thread of every unit in the high school program. And an example of that would be the 7 steps to strategic planning that might support decision making. And in addition, at the transition level, there are even podcasts that are included for kids to be able to participate in. And again, these are free links from our website under the program page, so I would encourage you to go there and check us out after you finish this session today. This is a slide that just shows a quick snapshot, again, of the grade levels spanning that age 8 to 18 from 3rd grade through high school. It gives you the number of sessions and the length of a typical life skills lesson. Let's take a little closer look at the elementary school curriculum. Each level can stand alone. We span 3rd, 4th, 5th, or 4th, 5th, and 6th grade levels, and there are 8 sessions included in each curriculum level. Let's take a closer look at the topics that are included in the elementary program. We begin with self-image and self-esteem, and you'll see that also resonating in the very first level of the middle school curriculum. It's not accidental. Dr. Botvin has started the curriculum with self-image and self-esteem. It is so important because it influences how hard we try. Again, as we look at this self-image unit, you can see that this thread is woven across all 3 program levels, as are the subsequent topics as well. A typical activity, just to give you an idea of what you might see in a lesson at the elementary level, in the level 2 self-image, self-esteem lesson, we are really working to build out a definition of what self-image is and what it means to be unique. And there's an activity after facilitating a discussion around that where kids gather in a group of 3, and it's sort of like a Venn diagram. They gather and come up with all the ways that they are similar to the partners in their pair group, and they also come out with the ways that they are different. We then gather back after having that small group process to talk about the fact that we are all unique. Sometimes our self-image takes a hit because we don't feel we fit in, or we don't feel we're just like our best friend or someone we would like to have as a best friend. And the reality is that we are all unique, and there are some real gifts to that. So here we go, self-image, decision-making. In the elementary program, the substance focused on is smoking, and that is developmentally appropriate, as it is the gateway drug for kids to engage in unhealthy risk-taking. We look at advertising, how are kids now the target market of certain products, what kinds of tobacco advertising they might encounter, and what kind of techniques are used to persuade or lure them in. We also have lessons on dealing with stress and anxiety. We certainly see no small amount of this, especially in our student populations in schools, as we increase the focus on testing. We all are dealing with stress management, and what I like about stress management is it normalizes. We also in our middle school are going to see a session on anxiety and anger management. It normalizes all of these feelings. Stress is not unhealthy. It actually can move me to peak performance. It had Jen, our facilitator for our session today, doing sound checks to make sure that this sound could be heard here today during our session. That moves us to peak performance. We all experience stress. Not all of it moves us in necessarily a healthy way. If I were to lose my sound completely now, that would be unhealthy stress for me. I'd have to use a technique to navigate that. And we let kids see that it's not just them, that we all experience this. In terms of communication skills, as a 3rd grade classroom teacher, I loved the opportunity to build the toolkit for kids in terms of the way they navigate school settings or just even after school or other settings outside of their family. They are becoming more unique at this particular developmental stage. And so how I talk with my family may not be the best technique for me to talk with my peers. I may not get social distance, and so we talk both about verbal and nonverbal skills here in this particular lesson. We talk about social skills. How do we start a conversation? How do we make sure we're communicating effectively? We talk about communication as sending a message, but also having it received with the way that you sent it. And then finally wrapping up the content for the elementary session with assertiveness, talking about how to assertively respond for yourself. That means you accomplish your goals and dreams, but you don't take away the rights, the respect, or the responsibility for other people. So to summarize the elementary program, here we see a program with 8 lessons at each program level and a typical lesson taking about 30 minutes. I said earlier that life skills training is a program that we do with kids, not to kids. And embedded into the program are the teaching techniques that really keep this an engaging program. You'll see that as you have the opportunity to look maybe at a sample unit on our website, or if you've got the curriculum as well. You'll see that we keep this very engaging. As a classroom teacher trained more than 30 years ago, I thought, a quiet, busy classroom was a healthy classroom, and my tolerance for noise grew exponentially in that first year. Kids are busy and they want to process. Here you see the middle school curriculum, level 1, 2, and 3, again, a teacher manual and a student guide. The only other required materials would be that smoking and biofeedback DVD and the stress management CD. Looking a little more critically at the way the curriculum lays out in terms of looking at competencies needed to navigate middle school developmentally in a healthy way, we see a focus on personal self-management skills, on general social skills, and resistance skills. And in fact, this is actually the layout and design of the 3 levels of the program. You'll see at middle school level 1, a focus a little bit more on building your own personal toolkit, going out and then moving into general social skills and into those interpersonal domains in the middle school level 2, and then also moving out into the environmental domain by the time we get to that 3rd level. When we look at the personal competence skills that are woven throughout all 3 levels, we see problem solving and decision making. Something I like about the layout of the decision-making lesson is Dr. Botvin is not necessarily looking for the right decision when we're thinking about what the choices are. He uses sort of a traffic signal with a clarify, consider, and choose format. And we clarify the problem first, then we consider, and when we're considering what the options are, we consider all of the options, knowing how to weigh the risks and benefits to each one of those options. As a parent, as an educator, I loved it when kids knew the right answer. Even as an adult, I don't always know the right answer, and boy, can the decision-making skill set really come into play there. When we look at personal behavior change skills, we're looking at how to realize that our self-image is part of the totality of who we are, but influenced by the environment. I can feel very competent at school, but I might not be functioning in a very pro-social way at home. Or maybe I need to come to a better way to navigate friendships in my community. And so looking at personal behavior change skills, looking at anxiety and anger management, and also communication skills and social skills. Looking a little closer at the social skills, looking at the way that we communicate in terms of verbal and nonverbal skills, looking at scripts that we can practice for a conversation, that for every conversation there is a beginning, a middle, and an end, and that syncing up our message is important, that we want to make sure our verbal skills are matching what we're trying to communicate nonverbally. Looking at how conversations start, and looking at how to even offer a compliment to start a conversation, that the way to receive a compliment is simply to say thank you. We look at assertive skills, and when we look at this particular topic in our life skills lessons, we usually end up in a conversation about 3 ways to respond to a situation. We can respond passively, we can respond assertively, and we can respond aggressively. And certainly there is no small amount of social behavior, either in the social network or on TV or in communities, where we see kids and adults constantly blurring the way to respond between assertive and aggressive behavior. Reality TV has sort of rewritten the definition of reality, and friend is being redefined by the social network. And so when we talk about assertiveness skills with kids, I think in some settings the passive response has been diminished, and I think that it's okay to respond passively. We don't have to diminish it. I respond passively through any 30-minute news cycle every night on the news. I can't be mobilized into action from every single piece I see during that 30-minute cycle. Certainly if I respond only passively, I'm probably likely not accomplishing my goals and dreams either. And then we go into that assertiveness where we are able to resolve conflicts in a way that can be healthy and best for us. And that takes us into the final domain of competency, looking at the resistance skills and norms, being aware that there are short-term and long-term consequences. At the middle school level, here we are focused on alcohol, marijuana, and tobacco use. And so, again, we are not building that whole toolkit of what are the unhealthy risk-taking pieces that kids can possibly engage in. That kind of explicit focus, very specifically on each one of those unhealthy risk-taking behaviors, research has shown can actually increase the likelihood of kids experimenting and engaging in those behaviors. And so we walk that delicate tightrope between prevention-related drug knowledge and that information. We want to also normalize the fact that indeed not everyone is doing it. If I would even ask a typical cross-section of adults in my community, or you could do it in your community, likely is they're estimating much higher than what is actually the incidence of unhealthy risk-taking. In the resistance and skills, along with that accurate norming behavior, we also look at resistance skills in terms of how to stand up for yourself and then resolving those conflicts. And wait till you see the scope and sequence. Let's take a look at it. This is the scope and sequence of the middle school curriculum. So here we have a chance to take a look at the topics that are covered. And while you will not see the topic repeated in every single level here, that's different from the elementary version, you're going to see the threads of these topics certainly woven throughout the content of subsequent lessons. That's important to know because we want to teach life skills in the order that you see written here on the screen. This is not a jungle gym or a climbing wall where we have multiple paths. This really is the scope and sequence, so it's much more like a ladder. We start with self-image, we go on to decision-making, we have those units on tobacco, alcohol, and marijuana use. We move into the influence of the media, and you will see that across some of these levels there is a repetition, and I've had some teachers say, well, Pam, I think that's going to be boring for the kids. And I take a step back and talk a little bit in particular about the advertising unit. When we take a look at the advertising techniques, those techniques don't necessarily change, but the target of the market certainly changes. This child is profoundly changing from the moment they walked in as a 6th grader in my classroom until they left our campus at the end of 8th grade. And so the level of sophistication and the way that kids are experiencing this information changes almost explosively, as you know from your own community. We look at violence in the media, again, those personal skills focused on coping with anxiety and anger. Again, these are not bad feelings, these are normal feelings. The way we accomplish our goals and dreams and do not take away the rights, respect, and responsibility of others is important. And so it's okay to be angry, it's okay, we all feel stress. It's how we act next. What's the next right thing for us to do? The social skills lessons really are timely here as we think about kids sort of becoming, again, more independent, sometimes leaving a familiar setting and going to a new campus in many communities, if this is a school implementation. In the social skills, it's not just about looking. What are we looking for in a friend? But we also have to reflect back. And so I like to teach these lessons with a hand mirror, where I show the kids that this is what I'm looking for and it's all of them, and I turn that mirror around and see my own reflection. What do I have to build to become a friend? What skills do I need? What kind of attitudes and attributes do I need as well? In the conflict resolution, we look at a whole host of ways to respond to conflict, giving in, striking back, negotiating, compromising, and then the thread woven through conflict resolution is, do I maintain that relationship? There are consequences to the choices that I make in terms of whether or not I maintain that relationship. So that takes us through the middle school curriculum, and again, I know this is sort of a whiplash tour. I'm sure that this will be made available as a recording, so you can come back and take a look and pause this at your leisure in the future, or go to our website and take a deeper dive.
Thank you, Pam.
Let's move on to the high school curriculum then.
Pam, we have a few questions about
yes.
Is that okay for a minute? Okay,
yes,
so
great.
Okay. So how about as far as school-based, evidence-based programs like LST, how do they fit in with the community's broader strategies?
Well, that's a great question. You know, I just was on a webinar earlier this week for the Drug-Free Communities RFA. That's out right now for 2014. And when you look at the best practices, there are 7 strategies that are recommended. There are individual strategies and environmental strategies, and that really comes together, and CAD also has this information on their website, but there are 7 strands, and an evidence-based program is actually in the second strand of that 7-strand framework. It's the Strategic Prevention Framework. That's exactly what it's called. And so this is an evidence-based program. That is the second rung of that 7-step strategic framework.
And what about what's the best way for providers working with delinquent kids to suggest schools adopt LST?
Oh, that's a great question. The stakes are high, aren't they? I can tell already from that audience member, the stakes are high. We do see life skills training being used in juvenile justice facility settings, but it obviously is being used in the general population as well. And when I look at the return on investment for a program, again, SAMHSA has, if you do a Google, SAMHSA will have a study. And I think on our own website, there is a cost-benefit analysis that's been done by SAMHSA. I think on life skills training, for every $1 we spend on prevention, we save, I think the estimate from SAMHSA was $38 on intervention. And it becomes sort of an ethical piece. It's a delicate balancing act. In my heart, I believe that every community will come to prevention one of 2 ways. They'll either get the big picture that I'd rather spend my money here on prevention than on the intervention, which I only calculate the dollars, not the toll of a human life or a family or a community. I think that's one way people come to prevention. I think the other way communities quickly rally to prevention is they cannot stand the pain they are in any longer. And that's the most difficult. You know, when I've been in a community where I can't walk in a downtown area after 5 o'clock at night, and I've been in parts of America where that is true. You know, you see people trying very hard to bring their community back. That's where prevention comes into play. And for the caller who's asking that question as well, Jen, as you take a look here, somebody who is in a situation, let's say a middle school kid who is in a situation where they're doing some unhealthy risk-taking, these are sort of the very things that I want to pour into their heart. I want to give them better decision-making. I want to give them ways to normalize anxiety, that we all have it, and there are healthy ways to be able to respond. Does that help?
Yes, and just one last question. What about, can LST be used with kids in residential placements?
And in terms of residential placements, are we talking about somebody in a court-ordered program, do you think, Jen, or incarcerated?
Maybe a court-ordered program, like
okay.
a group home?
Yeah, I think that we do see that. That tends to sometimes be less in terms of honoring fidelity. But we do have this program being used in a variety of those settings, because sometimes these are indeed the deficits that child might need. But this may not be and should not be the only solution or focus of the kind of resource that individual child might need. And so as part of a toolkit in that residential placement, I would say woo-hoo, but we need to make sure we're addressing if there are substance use issues, if there are violence issues. We want to make sure that we're using the proper tool to be able to really augment this. I did a training in northern Minnesota with our Ojibwe community, and at the end of the training, one of the tribal elders said to me, Pam, life skills training isn't just for kids, is it? And I said no. And so again, I think that honors the breadth of the program. This really sort of is my life work here at age 57 even. So I think, yes, it can be part of the matrix, but again, not just only standing alone in that setting.
Thank you for answering those questions. I'll let you carry on.
Thanks, Jen. And again, just interrupt me again.
Okay.
So as we zoom into the high school curriculum, and again, I feel your pain because this is a lot of information to share. I, as a person who would be on this webinar, would need to percolate a little bit, and I'm not going to hardly even take a breath myself. And so please spend some time navigating this information and content by whatever learning strategy might meet your needs after we get out of here today. And again, there'll be contact information as well. At the high school curriculum, here we go, 9th or 10th grade. Here again, you're not going to see a whole shopping cart of widgets that you'll have to gather and go on a scavenger hunt for. It really is the teacher manual and the student guide. If there are any resource scenarios that are required, you'll find them right in the tab at the end of the teacher manual, so it's all kind of a one-stop shop right here. There are 10 sessions. It takes about 40 to 45 minutes, and some folks are going to be in a block program. And it does not work against the fidelity of the program if you would do 2 sessions in one class period. So again, it's nice to know from the get-go, from the research and the program developer side, that if you would do 2 sessions in a block setting, because our block typically is 80 to 90 minutes in most of our settings, that still would honor the fidelity of the program. When we look at the transition program, here again, 40 to 45 minutes, I really have to be organized. And I'm going to show you some tools that we have to help you be organized. There's a time and money management session in our transition program, but I want to make sure that I've got my time cues going and that I really am able to meet the needs of my students and still honor the fidelity of the program as well. Looking with a closer lens toward the high school curriculum, and let me just, I'm trying to be very cognizant of our time. I see we've got about 10 minutes left, so I'm going to try to really be very succinct here. This again is the layout of the content here in our high school program, focused again on all 3 domains that you saw crafted from elementary to middle school, now coming into high school. Lessons on personal self-management, on general social skills, and on drug resistance skills. I love this drug use and risk-taking unit. You have a chance to look and identify what kind of a risk taker are you. We do not all assess risk the same way. And again, normalizing the fact that we all take risks. You know, the fact that I 4 years ago learned how to do a webinar was a huge risk to me. And look at how wonderful and robust my career has become because of that. So not all risk-taking is unhealthy. We don't want to give that impression to kids either. In the transition curriculum, here are the 7 units that you'll see: goal setting and communication, again, decision-making and stress management, time and money management, and then building those relationships. In the communication unit, I love that it's just perfectly targeted to kids as they're getting ready to leave high school. Well, how are you going to communicate? Certainly, I thought I was communicating very effectively with my college-age son by leaving him voicemail. He never listened. He only saw that I called and called me back. So how are you going to effectively communicate? Are you going to text? Are you going to send an email? Do you need to show up in person? Making sure that you have the strategy that matches the need and the audience that you are really trying to communicate with. When we look in life skills training, again, I've told you that this is not a program that we do with kids. It's a program we do to kids. We have some kind of facilitated conversation with kids. I like to call it kind of laying the trail of breadcrumbs. I try to set up an environment where kids actually uncover and discover the content that I'm trying to have them engage with. Then I demonstrate how that can be used in a situation. So if it's goal setting, then I'm going to set a goal. The behavior rehearsal is actually the verb in life skills training. It's a little different than a role play in terms of perspective, and let me tell you why. In life skills training, I am not going to become Fred the drug dealer on the corner. Because if I become Fred the drug dealer on the corner, that's what's going into my toolkit. And that is indeed the lens that you are all seeing me as. And so a behavior rehearsal is something that's short, structured, and skill specific. It is exactly what we want kids to be dropping into that toolkit of experiences for their future healthy youth development. We check in with feedback, and again, those questions are built right into the teacher manual, looking at higher level thinking strategies focused on observation, suggestion, prediction, and analysis. These are the teaching skills, but I think you've heard me talk about those, so I'm going to kind of blast through them a bit. We facilitate and coach the behavior rehearsal, again, taking it into action. This is cognitive behavior theory in action. It's not enough to give information. We have to do something with it, and we want to use it as our own person, not as someone else. That increases the likelihood that when we need that skill in a setting in the future, we'll be able to fall back on it. It's important to do the program with fidelity, to follow the recipe. And to follow the life skills recipe, you teach the full scope and sequence. As I mentioned, you teach the units in order. You teach at least once a week, and I told you already that at the high school level, it's okay to do 2 lessons in a block. We use those interactive teaching strategies. This is not a lecture program. It is an interactive program. And that while it's great to do one level of life skills training, that we see less decay and an increase in protective factors if we do the subsequent sessions. When we talk about program adoption, we know that people who are trained in life skills training become better implementers. They get the big picture, they understand the interactive teaching strategies. We have on-site and online program training that is available. When we look at the outcomes, certainly truancy and attendance are important, engagement and commitment. We want to foster a safe and supportive learning environment. We certainly see no shortage of opportunities to take some of that scope and sequence right into action in terms of academic pressure with all of the testing that kids experience today. It's a pro-social engagement with teachers and their peers. This is the definition of social emotional learning. It really is. It's got all of the pieces put together. And when we look at the kinds of outcomes that we were measuring very early, and again we'll task you to our website to look under our research tab, these are the protective factors that we want to build for healthy youth development in our communities. Let's take a look at the resources then, and I'll try to finish up in just about a minute, Jen, so that if there are any questions, you can jump right in. There are fidelity checklists. I think these can aid you as a new implementer in life skills training. For me, they help me make sure that I'm covering the key information. These resources are found on our website. The program at the middle school has been aligned to the Common Core, so if that is something that would be important to you, it's been done. It's under the implementation tab on our website. There are session support slides. These support slides, and if you take a look at the panel over here on the left, these support every single life skills lesson for the middle school program. And as you look here, coming online this year, the high school and transition program will have this kind of online kind of technology support as well. We have actually a website that is available to help support teachers at the middle school, high school, and transition program level. And that is free of charge, and you're able to access that from our website. And it also has a whole student side. And if I would click on one of these student levels, this is the middle school, but it's available for the high school and transition program as well. Interactive activities, podcasts, articles would all come up and be available. For the elementary program, there is a CD-ROM that is available to support lessons, and again, there's a parent program that is interactive as well. So, oh my gosh, this has really been a whiplash tour. So to summarize, there is a bulk of research. At my stage in my career, life skills training is in my professional toolkit because I don't have time to waste. I I need a program that can work, that can be effective, that can be affordable, and doesn't send me on a scavenger hunt. I need a program that can be done in rural and urban settings and in populations of diversity. I need a program that crosses sort of an umbrella of unhealthy risk-taking. And again, this payback, the return on investment, you can find those numbers on our website under the resources, but you could also do the homework yourself. Google SAMHSA and do cost-benefit analysis, and you'll come up with a whole host of studies that show the payback in return on investment. This program has been used all across the United States and now in 32 countries. Thousands of teachers and prevention specialists and youth workers are using this program all over the world, and hundreds of thousands of kids are experiencing the message. The program starts from elementary and goes all the way through the end of high school with even a parent program. You heard someone ask the question about prevention infrastructure. Using the strategic prevention framework, which is best practice in our country, it's being required in drug-free communities. It's being promoted by CADCA, the Coalitions for Anti-Drug Use, and you'll see that there's a focus to two parts in prevention, that there are individual prevention strategies and environmental prevention strategies. One silo doesn't make a difference. I can't just do individual. I cannot just do environmental. I need to have both silos come together, environmental and individual strategies, to really create the totality of best practice in prevention for our kids. So this is the contact information. Jen, do you have any questions?
One quick one. How about LST in Latin America? Do you have good results?
That's a great question. I know that Dr. Williams, I was co-presenting with him just a few hours ago. I know that Dr. Williams has been in South America. I know that there's an implementation going on in Brazil. I know that that information is available. I am not privy to that. I have not been involved with that particular implementation. So please call and reach out via email for that answer. But we're doing it.
Thank you so much, Pam. You should all know that she was on a webinar this morning just before joining us for 2 hours. I can't believe you didn't lose your voice. You did great.
Thank you. I'm glad the sound worked, Jen.
I am too, and you sounded great, and so thank you so much. We're going to launch a quick poll real quick, and so if everyone will have a look on their screen, I'll get that up. You'll see the first one there on your screen was the information in the webinar well presented. And I'll give you a second to answer that. Okay, great. Okay, and the next question, was the information presented interesting? And we'd also like to know if this information will be useful in your work. And if you're interested in learning more on this topic. You should know that this will be available on our website at www.advancingevp.org. Go there in a few weeks for the recorded version and share it. And also join us next month on March 14th, which is again a Friday, for a webinar on communities that care. Thank you and have a great day.
Thank you, Jen.
Thanks.